Hi, and welcome to the Restore Body Balance YouTube channel. I'm Colleen Burns, licensed psychotherapist and founder of Restore Body Balance. Here we combine psychology, biology, and neurology to enact life changes that stick. Today's episode is on stress management. We're going to be finding ways to take experiences and everyday occurrences that agitate or put us in that stress-based response, and we're going to find a way to basically antidote so that we can therefore have a more pleasant experience and be in that safer, happier parasympathetic nervous system of rest and relax, rest and restore, rest and digest. We're going to be borrowing some of the techniques that I learned at the Benson Henry Institute at the Mass General Hospital in concert with support of the Harvard Department of Psychiatry. So I'm donning my sweatshirt after my completion last year of the SMART program, which is an acronym for stress management and resiliency training. So how do we become more resilient, especially when we're in that stress-based response? Today, we're going to learn two techniques. As a cognitive behavioral therapist, I went ahead with this certification because even though I was very proud of my education, I still felt like my clients were getting stuck. And the art of cognitive behavioral therapy we've often talked about is that acronym, which is ABCDE. A is the activating event, B is the behavior, C is the consequence, and D, for 15 years, is all I told my clients. You don't have to remember anything else. We're just going to dispute the belief, dispute the belief, dispute the belief. Every time you're having a negative thought or feeling or emotion or re-experiencing of something, just dispute that belief system. If you dispute the belief enough times, the E is the new emotional consequence. So after the completion of my stress management and resiliency training, I became very proficient at being a mind-body practitioner. And so the two phrases I'm going to add on to that ABCDE is cognitive reappraisal and positive expectation. When I first heard this, I was a little skeptical because who wants to go see a therapist that says, look on the bright side, or the positive expectation of something and the cognitive reappraisal of making it better? Well, when we looked at studies that supported evidence-based practices for cognitive reappraisal and positive expectation, people going through chemo and cancer treatments that had cognitive reappraisal and positive expectation actually fared better. Patients that white-knuckled waiting for maybe the results of a test fared no better, and in fact a little less productive and not as well as those that took a more mindful approach to waiting for a result, potentially having that reappraisal, and the positive expectation. I drove my family crazy every single day, walking around saying cognitive reappraisal, positive expectation. Negative thought or feeling, cognitive reappraisal, positive expectation. Here's an example. In my book, Prescription for Change, I give the ticket on my car running through my head, being in the stress-based response, that prime example of how we take a negative event or experience and cognitive reappraise it with positive expectation. My example with the ticket is I was running late for a client. I was trying to pay the meter. It kept saying remove card, remove card. I was removing my card. My card in fact was in my hand, but the kiosk kept saying remove card. So like any iPhone bearing person, I quickly took a photo of the kiosk, ran in to see the client, ran back out after, only to find a ticket on my car. Well, let's just say on the way home, some expletives and a few phone calls to friends at my frustration with the system and getting the ticket. But when I arrived at home, I do practice what I preach. So I made a cup of tea. I did not go to my computer. I did not go to my phone, but I sipped my tea. And when I looked down in teeny, teeny, tiny little print, at the bottom of the ticket, I saw that you could dispute the ticket online. And it dawned on me, Dispute the belief? Dispute the ticket? Wait a minute. This is good news. This is actually really good news. I don't have to spend my entire Saturday in the Brookline Police Department with 25 other angry residents trying to get their ticket dismissed. And then when I flipped it over and read further on the ticket, you could actually upload your evidence. Again, going back to that picture I took. So the reappraisal is, thank goodness I didn't have to go sit in the police station. The positive expectation is, and I have evidence that this actually wasn't my fault. I actually tried to pay my meter. That's the positive expectation. So remember the phrases potentially I've said in the past. You have an unpleasant experience, you have unpleasant thoughts or feelings, and then potentially maladaptive or unpleasant behaviors ensue. That's ABCDE, activating event, behavior, consequence, dispute the belief. And then E, if you do it enough times, you have a new emotional outcome. Well, with the Benson Henry Institute, we learned that actually helps, but you can only do it when you're in the relaxation response. So take a deep breath. Turbinates of your nose or aim straight down at your diaphragm. Your diaphragm expands, tripping you into the parasympathetic nervous system by hitting the vagus nerve. And the inhalation, your heart rate speeds up, but the exacerbated exhalation slows your heart rate down. Take a couple of good deep breaths when you're stressed out or having an unpleasant thought, feeling, or experience. And then in that sympathetic system of fight or flight, we eventually get into the parasympathetic nervous system of rest and relax, rest and restore, rest and digest. And therefore, this is the time for us to give the cognitive reappraisal and positive expectation. It really does work. It's evidence-based, it's scientifically proven, and like I said, it was a game changer to be able to teach my clients techniques that they could use outside of the session. The support here in the science is that you actually are looking at allostatic loading of the body. When we're in that stress-based response, don't forget, all that blood's going to your feet to flee or your fist to fight or potentially stay frozen. And that is called allostatic loading on our body. And the first thing to go is our immune system. Then we create an inflammatory response, and that's really not doing anybody any good. So simply by giving a cognitive reappraisal and a positive expectation, after having a couple of deep breaths, we get out of that oxidative stress on our cells and on our body, and we get into the parasympathetic nervous system where we are amenable to change. So give it a go. Contact me at www.restorebodybalance.com should you have any questions. And if you want to hear more YouTube sessions on stress management and the science of psychology, biology, neurology, click the subscribe button, and I look forward to seeing you next time.